I'm Dr. Stream, a board certified family medicine sports medicine doctor. In this video, we're going to discuss about the newer non-insulin type 2 injections, which are basically the GLP-1 analog injections, and how they work for type 2 diabetes. So the examples of these medications include Exenatide, which comes as Byetta or Bydureon, Dulaglutide, which comes as Trulicity, Semaglutide, which comes as Ozempic. So in my opinion, the GLP-1 analog injections are a huge breakthrough in the pharmaceutical industry when it comes to the treatment of type 2 diabetes. So as we have discussed in my previous videos, type 2 diabetes is due to insulin resistance, but also coupled with pancreas unable to meet the demands of the insulin resistance. So our focus is not only to improve the blood sugar, but also focus on reversing the insulin resistance. So in my clinical practice, I've used this medication in a lot of my patients with type 2 diabetes and I've got tremendous benefits from it. For example, one of my patients recently utilized this medication and then he made those lifestyle changes to achieve diabetes remission. And I've covered the entire video on his story. I'm going to link the video at the end of this video. So before we talk about the GLP-1 analog injections, let's first understand the hormone GLP-1, which is naturally produced in our bodies. So within the lining of a stomach and intestine, there are specialized cells. So these cells respond to the stretch of a stomach or intestine, and they also respond to the presence of carbohydrates by releasing a hormone known as the GLP-1. So the GLP-1 signals the pancreas to increase its production of insulin, acknowledging that we have consumed food. So what the insulin does is that it lowers your blood sugar. Furthermore, the GLP-1, it also interacts with the neighboring cells responsible for producing glucagon, and it decreases the glucagon release. So usually glucagon actually increases blood sugar, but the GLP-1 decreases glucagon and increases insulin, and thereby it leads to a decrease in blood sugar levels. But here's where it gets interesting. So the GLP-1, it slows down the emptying of the stomach, and thereby it provides a sense of fullness and decreases the appetite, which helps to regulate food intake. So the GLP-1 injections are pharmaceuticals that have been developed to mimic the effects of naturally occurring GLP-1, while also being engineered to have increased stability and resistance to degradation by the enzyme called as the DPP-4. So by doing so, the medicine stays for a long time within the body. So the primary benefit of GLP-1 is that the release of insulin is primarily triggered by food entering the intestine, making it largely depend on blood sugar levels without causing low blood sugar complications. At the same time, its ability to slow down intestinal motility and promote a feeling of fullness in the stomach is a main advantage. This not only aids in reducing your blood sugar levels, but also helps to facilitate weight loss. So this is why these medications have been used for weight loss recently. So some of the examples of these medications include Wegovy, which is still semaglutide, and the other one is a Saxenda, which is basically liraglutide. So in the context of type 2 diabetes, it is also worth noting that there might be an underlying issue related to inflammation of pancreatic beta cells. So this particular phenomenon can result in temporary reduction of insulin levels, consequently leading to an increase in blood sugar levels. So a study from 2012 have indicated that Exenatide, which is basically comes as Byetta, they have shown promise in decreasing pancreatic beta cell inflammation and thereby effectively contributing to blood sugar control. So even though high blood sugars can pose complication in type 2 diabetes, it is also important to remember that the insulin resistance also drives complications. So the focus is not only to decrease the blood sugar, but also to decrease the insulin resistance. For example, in the case of managing blood sugar control, prescribing insulin alone may not effectively address insulin resistance unless the person also makes corresponding changes in their lifestyle habits. So numerous studies have confirmed that solely relying on insulin does not yield improvements in mortality rates in type 2 diabetes. So now this medication, the GLP-1 analog injection, they not only lower blood sugar, but they also help with weight loss. So theoretically, this translates to decreased insulin resistance, which should actually cause improved longevity. Now the question is that, is there any evidence to show that GLP-1 analog injections actually decrease mortality? And fortunately, there is evidence. So according to a recent comprehensive study, so the GLP-1 analog medications have shown promising results in reducing the mortality rate, which is basically dying early. However, it should be noted that these benefits are particularly significant for patients who fall in the high-risk category, such as those with pre-existing heart disease or kidney disease. In contrast, for low-risk patients with recently diagnosed diabetes and no additional risk factors, the long-term advantages of using these medications still remains uncertain. So the key point from this study is that there is no miraculous treatment to replace healthy lifestyle habits for type 2 diabetes. So let us say a person has diabetes without any of the risk factors like heart disease or kidney disease, then healthy lifestyle is still the superior treatment option. However, for those who have existing risk factors and a need for immediate improvements to their health, then these GLP-1 injections can serve as an additional aid alongside their efforts to change their lifestyle. So far I've shared the benefits of these medications. Now let us discuss about some of the issues that my patients face. The first issue that my patients face are the cost of this medication. Let's say the insurance don't cover this medication. These medications can run somewhere around like $600 to $1,000 or so for just 1 month of prescription. So animal studies and analysis of drug databases have suggested an association between the GLP-1 injections and pancreatitis, pancreatic cancer, and thyroid cancer. However, several meta-analyses have failed to confirm a cause-effect relationship between the GLP-1 injections and the development of these adverse effects. So what this means is that, let us say if someone has a personal history of pancreatitis, it is basically inflammation of the pancreas, or let us say if they have a family history of thyroid cancer, or let's say a family history of pancreatic cancer, then I would be hesitant to start this particular medication in these patients. So common side effects of the GLP-1 injections include gastrointestinal symptoms such as nausea, vomiting, diarrhea, constipation, abdominal pain. So injection site reactions, headache are also commonly reported. So these side effects are usually mild to moderate and they do not lead to discontinuation of therapy. However, I've had patients who have discontinued therapy because of like extreme nausea or the constipation that they face. So finally, this is my biggest concern. So this is a new drug and we don't have any long-term studies like 20 years, 30 years or so to ensure the safety of the drug. So because of this, my goal is to use this medication, implement lifestyle changes, help to get the diabetes under control or even like diabetes under remission. And after that, we can slowly wean off these medications in a period of like 1 to 2 years or so. Wait, did I say diabetes remission? Yes, I said that right. Diabetes remission or even like reversal of diabetes, whatever you could call, is definitely possible in type 2 diabetes. In a recent study from 2023, it was found that a combination of lifestyle changes and medications can effectively manage diabetes and even lead to remission. In this study, participants were administered metformin, a commonly prescribed drug for diabetes that improves insulin resistance, as well as the GLP-1 injections that we talked about, and then they also used insulin. So initially, with the implementation of the intensive lifestyle modifications along with these medications, nearly 40% of individuals achieved remission of their diabetes. This research emphasizes the potential for individuals to take control of their diabetes through a comprehensive approach involving both medical intervention and changes in lifestyle. So you might ask me like, how is this even possible? For that, I would recommend checking out this video where I'm walking through the entire story of my patient John, who actually achieved reversal of his type 2 diabetes, or you can also call he got his diabetes under remission by using both medical and lifestyle changes. So basically, we started him on medication first, and also by implementing lifestyle changes, he was able to get diabetes under remission. By watching this video, you will get all the helpful tips that John used so that you can use that too to get your diabetes under remission, or you can reverse your type 2 diabetes. So if you found this video helpful, can you do me a small favor? Can you please hit the like button so that this video can reach more people, okay? So if you have any questions or comments, please post in the comment box below. If you're someone who enjoys an active and healthy lifestyle, then this channel is just for you. Please make sure you hit the subscribe button, and I'll see you in the next video. Until then, goodbye.